Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. You may have heard concerns about the dangers of plastics to human health, so I'm turning to Dr. Kaushal Nanavati to explain. He's a doctor of family medicine and director of integrative medicine at Upstate. Welcome back to the Informed Patient, Dr. Nanavati.
Thank you for having me, Amber. It's been a while, and I really enjoy coming on.
Why have black plastic food containers and kitchen tools like tongs and ladles and spatulas been singled out as potentially problematic?
Well, there was a study that came out, and it really focused on the fact that black plastic tools are often made from recycled plastics, including what we call e-waste or electronic waste. And e-waste plastics can contain things like heavy metals, flame retardants, and other potentially hazardous substances. So in the study, it talked about the increased risk potential for things like cancer. Now, I do have to kind of give full disclosure on the study is that initially the data that came out uh, projected a much higher correlation for cancer risk. And so the authors looked at the data and they realized that their actual calculation was off by a factor of 10. And so they did, correct their information, but the correlation is still there and the risk is still there. So I think it's a very, very important, discussion to actually have and just to inform people on.
Well, I think everyone has black kitchen tools. Should we be getting rid of them?
Well, I think the question really there is, what can we do? So if you don't have them, you don't necessarily need to get them. But really, the thing with black tools are that you want to think about what it is that they have. So there are certain types. So plastics that are marked with recycling codes number 3, number 6, number 7 may actually leach more harmful potential chemicals. So what we tell people is there are alternatives. So fundamentally, within plastics, tools that are clear or lighter colored tend not to have as much of the e-waste. So that's one thing to keep in mind. But there are also alternatives, right? So wooden tools are safe, they're biodegradable. You just have to be careful about avoiding splintering and then how well you clean them as far as harboring bacteria. Silicone tools, if it's food grade silicone, they're durable, they're heat resistant and safer. And then even glass or stainless steel containers are ideal for food storage versus plastic. So there's fundamentals that we can do at home to think about how we can optimize or rather minimize our exposure to potential chemicals that could lead to harmful effects when you have consistent exposure over the long term.
Are these tools safer to use if you're not dealing with hot food?
So, with cold use, you may release fewer chemicals. You have to think about if there's wear or scratches in the tool itself, then that could sometimes leach some of the hazardous compounds over time. So, one-time use when you're visiting somebody isn't really the thing as much as what you use on a day-to-day basis at home in terms of serving spoons, utensils, that type of stuff.
Now, if you take the step to toss your black plastic tools, should they go in recycling or trash?
So it's really a very interesting question because they don't really recommend recycling because recycling environments don't really know what to do with them. And so generally the recommendation is that you throw them out in the garbage and then they get disposed of that way.
Now, the other thing is those black plastic food containers that you often get with takeout food. Are those safe to reuse?
So again, if they're not scratched up and banged up and kind of, worn down, for storage, it's different. If you're using them to do things like microwave, even though some of them might say microwave safe, we generally suggest using glass containers. If you're going to do anything as far as reheating, I wouldn't suggest using those containers.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Dr. Kaushal Nanavati. He's a doctor of family medicine and director of integrative medicine at Upstate, and we're talking about how to stay healthy in a world full of plastics and microplastics. So I'd like to ask you about microplastics, these tiny shards of plastic that are in the air and the water. They're byproducts of our world, which is just full of plastics. We're all exposed to these, and it seems more and more studies are showing potential harms. What can you tell us about these?
So microplastics are found in really everywhere, right? So from food, including fruits and vegetables, seafood, bottled water, honey, milk. I mean, wherever you look, things that are stored in plastics. As the researchers do more and look into more things, they're finding microplastics in the air and in the soil and within the body in multiple organs. The microplastics can cross the blood-brain barrier, so they can impact the brain and development of young people, breast milk, the placenta, testicles, heart, the liver, the kidneys, clothing, cosmetics, cleaning products, and also nail polish and that type of stuff. So they're pretty much everywhere. Trash, dust, tires, all of those things. And what are the harms, right? So really, when you think about it from the digestive tract, we think about inflammation that can be triggered, and that can affect the gut bacteria, which can affect nutrient absorption, toxin release, even things like abdominal pain and bloating, changes in bowel habits, breathing issues. They can get into the lungs, resulting in coughing or inflammation, shortness of breath for some people. For the brain, because they can cross the blood-brain barrier, we worry about things like neurotoxicity with repeated exposure over time. And we think about reproductive issues, endocrine hormone-related issues, as that can be affected as well. So there's really a multitude of issues. And part of the concern really is that they're ever present. Plastic is used around the world. And at this point, it's not that we can necessarily completely avoid exposure. It's looking at minimizing the potential of exposure and where we can take individual steps, to help ourselves and to help our environment, to help our community. I think that's really the way people want to think about it. There's a famous thing about thinking 7 generationally. And if you think, how you want the world to look like 7 generations from now, and we make some of the decisions that will leave it better for 7 generations, that's a wonderful way to kind of approach the steps that we take, on a day-to-day basis.
Do you think the microplastics are behind the rise in lung and colon cancers in young people? Because we've seen a huge increase in that.
It's a good question. I don't know that the data clearly details that this is a primary cause. There's a lot of correlation that's been seen, and I think more research is being done to clarify how much of an impact microplastics have. Clearly, they do lead to what we call oxidative stress and inflammation, both of which have the potential to trigger cell damage that could lead to precancerous change. So a correlation is known. Causation, there's still more data coming. And clearly, there's not a health benefit to exposure for sure.
How would we know if we have microplastics in our body?
That's a great question. At this point, for most of us, we've been exposed to them. And unfortunately, we don't really have tests. Like for a lot of things, even chemical exposures, we have, blood tests and urine tests that can look for some exposures. With microplastics, we don't really have any standardized testing as of yet. There's a lot of research being done. What can we do to help ourselves, right? If we've all been exposed at some point, let's say, what can we do? There's really not a specific method to remove microplastics specifically. However, coming back to people have heard me come on the show before, the fundamentals are still fundamental, right? So what can we do? Having a fiber-rich, antioxidant-rich type of diet can help reduce the potential damage, the secondary effect, staying well hydrated. And again, when we talk about staying well hydrated, it's not drinking from the plastic bottle. It's using the bottles that we use or glasses that are actually glass, or the stainless steel containers that are free of bisphenol A and some of these other chemicals that are plastic related, to reduce the potential of inflammation, to reduce the potential of oxidative stress, and in fact, to help the body heal and to stay healthy in the first place, so that we can try to avoid the problems coming on in the first place.
Will that help us get rid of the microplastics from our body?
That's very difficult. It'll reduce the potential of the microplastic doing as much damage. Microplastic has been found in feces, and so the body does get rid of some of it, Oftentimes, a microplastic gets deposited into fat cells in the body as well. And so staying healthy is very, very important. Staying fit is very important as well. But we don't really have, like, I can't, tell you that there's a pill or there's some medicine that gets rid of microplastics from the body at this point.
Do you think it would be realistic to live a life without plastic? It seems like it's everywhere.
It's everywhere. So, what can you do to reduce exposure? So, first thing is to live it without is very difficult around the world because of environment, and the fact that it's found in air and other places. However, trying to use natural, reusable materials such as glass or stainless steel or even bamboo is used for utensils. Those are probably the ways to do it. Avoiding single-use plastics like those water bottles that a lot of people get. They'll buy bottled water and they'll drink from that. What we don't know is how long that bottled water has been sitting there in a warehouse. We don't know how much the water has been exposed to the plastic container that it's in. Plus, plastic is very difficult, if at all, to degrade. So if we're using single-use plastics, we're just creating more plastic pollution. So that's important. And then on the broader scale, in terms of institutional, community, governmental policies, supporting policies that reduce plastic production and waste. I know that they're working on biodegradable plastic that's made from natural elements that biodegrade more easily over time with plastics engineering. If we're able to create, storage materials that are biodegradable, that also have the ability to maintain food integrity, that would be ideal.
Well, Dr. Nanavati, thank you so much for making time for this interview.
I appreciate it. I think it's a very important topic, and I appreciate you guys putting a spotlight on it.
My guest has been Doctor of Family Medicine and Director of Integrative Medicine at Upstate, Dr. Kaushal Nanavati. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.